Perfect. Okay. Well, I appreciate the kind introduction. Thank you for having me and allowing me the opportunity to tell you a little bit more about the Canadian Retinoblastoma Society. I will share my screen here so that I can get the ball rolling. Okay. Oh, my apologies. Started one page too soon. Okay. So, as mentioned, I am Genevieve, and I'm the current president of the organization, and I'm also a retinoblastoma survivor. I'm going to tell you a little bit about the agenda for today, just to keep it formal and slightly. I'm going to explain about the early days of the Retinoblastoma Family Association, go over our missions and values, successes from our past, including the National Retinoblastoma Strategy. I'll introduce you to our board of directors, go over some strategic planning into 2024. And I'd like to share with some of our frequently asked questions from our community members. I'll show you our events calendar and see if there's any questions or any discussion that comes about in the end. So the early days includes, I was diagnosed with unilateral retinoblastoma at 8 months old, and that's me there with my mom. I'm gonna move over my little screen there. Okay. In the early days at Sick Kids, my mom noticed that there was a need for support, and she would look around the waiting rooms for other kids who maybe had eyes enucleated, and she would go over and speak with those families and try to figure out if they had RB. And eventually she formed a telephone tree between other parents and started finding support within her own peers from hospital visits. Over time, Dr. Galley started to notice and asked for us to come down and meet with families and discuss our experience and support people. And it kind of formulated a bit of a trend, and she put pieces together and formulated the Retinoblastoma Family Association. In 1985, 1986 was about the onset. They held meetings, created a newsletter to spread information, discussed research initiatives, events, held fundraisers, shared survivor stories, and of course provided various seeding funding towards research projects. I built my confidence throughout this process by sharing my story with various platforms as I became a public speaker on behalf of the Terry Fox Foundation and a Terry's team member, as well as through the opportunities of meeting other families with the Retinoblastoma Family Association. So I just wanted to throw in a small nugget of my own experiences and how I grew strength through the opportunities to share my story. Back to the organization, became an official charity in 2003. That's when the name changed as well to the Canadian Retinoblastoma Society. It is a federally incorporated, not-for-profit, run by a team of committed volunteers. There is an elected board of directors who oversees the planning and execution of the charity's responsibility within the Canadian retinoblastoma community. There's been over 35 years of supporting and advocating, educating, and empowering families who have been affected by retinoblastoma. And over this time, leadership has changed hands, but the vision has not for the organization. And I say leadership has changed hands as that there were times in my life and throughout my mom's time that we were a little bit less involved, and I was going through other things in my experiences as a teen and university where I didn't identify as much with the community, and then came back around in my adult life and have been a lot more involved and committed as it's come more relevant than when I had children. Our mission is to provide education, advocacy, and peer support to Canadians touched by retinoblastoma, and you will see this throughout our programming and the efforts that we put forth. Our vision is to provide a supportive and safe community for everyone who has been touched by retinoblastoma in Canada. And of course, that extends beyond Canada, as you know, social media and conferences have allowed for a much bigger platform and for us to collaborate and communicate with individuals from other countries as well. Our values are written here with the acronym REACT. So just to quickly review, we want to remain relevant, as our resources and programming should be tangible, have a tangible impact for those involved. We want to offer empowerment as we enable our community members to advocate for their individual and family needs. Accessibility. We want our services to be available for real life circumstances and meeting individuals and families with where they currently are and what they're currently experiencing. We look to be community oriented, as many of our activities would be reflecting the needs and the wants of our RB community directly, and much of our feedback is from our community members. And then trust. We must be trustworthy and speak authentically to and for those who have been touched by retinoblastoma. The pillars of the Retinoblastoma Society, as we go back to our mission: education, advocacy, and peer support. So medical information and language can sometimes be overwhelming for families, and we feel that it's important that it's accessible for all and that families and parents and caregivers feel informed. And we want to provide valid information on research, treatment options, resources, and related organizations which might be in that family's community, as well as commonly used terms and some jargon that might feel like it's really over someone's head. Advocacy, very important in terms of providing a standard of care and a guideline for what type of access each family should be receiving. Resources in each individual community, as well as beneficial programs and services, and being informed on current medical practices. And of course, we want to look to increase awareness within our Canadian communities. And then peer support, I think, really is our bread and butter, as we really look to provide survivors, caregivers, and parents with an opportunity to communicate and connect with others who share similar experiences. We want to offer a supportive community who can relate to the triumphs and the challenges during a very serious medical intervention. We look to provide events that would connect families across the country with each other to share unique stories. And just this, I can speak to from my own experiences, that there is something unique and special about just being around other people who have experienced similar rare things. So for myself, if I meet another RB survivor or another person who has a prosthetic eye, often there's no words even needed to exchange. We just kind of get each other, and certain nuances are just there. You just know that they understand. And I don't think that's something that we can take for granted when we have such a small community, that we have this platform to be able to connect those individuals. It's very important that I think we do that. I'd like to touch a little bit on some of our past successes, because as I mentioned, the organization has changed hands, and I don't know or can't speak to every single one of these triumphs myself, but I've heard of all and been impacted by, as a patient, many of these initiatives. So obviously there's been countless fundraisers. There's been a number of gatherings. There's been a triumph of support provided between parents and caregivers, clinicians, patients, community of survivors and their family members. Advocacy has been a big piece for the organization in terms of taking on various opportunities to advance understanding of the disease. The government health insurance funding for molecular testing was a big one, as well as the hospital care requests. I remember seeing letters written by my mom in the late 80s requesting to go in with me during EUAs. that she wanted to be beside me, because she tells me, I don't have concrete memories of, her being, me being taken from her in the waiting room and going for EUAs on my own. And so there were all kinds of discussions about the value of an eye and the losing of an eye, and how far do we go to preserve the natural eye. Various presentations made at medical symposiums, and the formation of the National Retinoblastoma Strategy, which I will speak to a little bit more. And then, of course, awareness around medical publications, media, hospital packages, promotion, and as much as we can, getting out the word about this disease and the opportunity to connect with others. So speaking to past successes, I wanted to touch briefly on the National Retinoblastoma Strategy, as I think this is an important piece of history in this rare cancer, pediatric cancer. So the strategy was co-chaired by the previous president, Peggy, who also is an RB parent, and from Saskatchewan, and Dr. Brenda Galley. So they looked to ensure that all Canadian families affected by this disease would have equal access to the same high level of care. So this would include an awareness program aimed at primary care physicians to encourage early diagnosis, creation of a monthly tumor board where all the retinoblastoma physicians can conference, discuss their ongoing cases, and benefit from each other's knowledge, as well as the creation of the national treatment guidelines for Canada for retinoblastoma. So there were experts from around Canada involved, including ophthalmologists, oncologists from all of the 4 main retinoblastoma treatment centers, which are Vancouver, Montreal, Halifax, and Toronto. And this also included geneticists, genetic counselors, nurses, social workers, patients, and parents. An important piece that everyone was included here in terms of their input. So the outcomes here of this national strategy, which was developed and is now being reviewed and reconsidered as well, was the development of these standards and clinical guidelines to access care. There was discussion on, so the main topics or the main issues that were highlighted when this national strategy was being put together was the rarity of retinoblastoma and the large size of Canada makes access to optimal care very challenging. So this imposes delays, my apologies, and hardships on families. In some provinces, Canadian retinoblastoma families do not have access to the best practices in genetic diagnosis. And this was maybe also at the time. And despite the fact that Canadian science leads in this area, the struggles of retinoblastoma families to access this policy, it comes to genetics. So when we're looking at families accessing this issue, I guess genetic diagnosis, it's really, there's a gap there in terms of what is available. Better awareness of retinoblastoma among primary health caregivers is the key step for early diagnosis or earlier diagnosis, and enhanced visual outcomes for the child. A greater understanding of what retinoblastoma is, how it can be recognized, and the best available treatment options would be best through a national coordinated approach. The awareness of the long-term health care issues faced by retinoblastoma patients is the key to early detection of secondary cancers and ultimately cost savings for the healthcare system. And of course, the psychosocial impact of retinoblastoma on these families, despite the varying severity of the disease, the ethnic backgrounds, the financial resources, the geographical location, and other various factors, identifying these issues and providing access to adequate support enables families to cope better with this disease. And it is our responsibility to future generations to have well thought out research, implementation of discoveries, particularly for this very rare disease, a national and international cooperation is really the way to advance the knowledge and provide improved opportunities for children. This was a bit of a snippet from the national strategy itself. So it gave you a little bit of an understanding of where the issues were identified and how they were tackled is a very long document. So they're also developed teaching modules for the colleges of medicine. There was an implementation of a national approach to deliver a quality level of healthcare, setting an example for other rare diseases as well as for other countries, as in the recent years, Kenya has been in the process of developing a retinoblastoma national strategy. And then there's also review and reconsideration of this strategy and ongoing research on what is the most impactful and what are the issues that we need to be addressing as a community. Like to introduce you to our current board. So myself there, Genevieve, I'm the current president. Jennifer, who is on with us, is our board chair. Brian is our secretary treasurer, Natalia, a fellow board member, and David, a board member. And previously, or in the past, this organization has typically been run by parents of children with retinoblastoma. And I believe this is the first time that the majority of us are retinoblastoma survivors ourselves. And most of us are parents, but none of us are RB parents. So also speaks to the fact that we all had a genetic disease and none of us have yet passed on the gene. So these are my lovely board members who I'm extremely grateful for and have also a passion to give back to this community. So in this past few years, as I've taken the opportunity to run with this, we've developed a new strategic plan with support of the other board members. It was developed to ensure consistency and purpose at creating more institutional memory. So we would have anticipated and expected stable programs and opportunities for people to connect. We've created committees to focus on our missions and our visions. And we formed action plans to set and obtain our goals, which we meet monthly, discussing our formed action plans, updating each other, and moving things forward. We continue to seek volunteers to join our committees to support our event planning and social media management. And we would love to welcome other parents as well as people who don't have necessarily a personal impact by retinoblastoma. So it's not a prerequisite that you have retinoblastoma in your family. We love to work with all volunteers. I wanted to show a little piece of us, our bread and butter, as I mentioned, bringing people together. So this is one of our events a few years ago, I guess now, maybe 2 years ago. This is the Child Life group taking some photos on the stairs. And I do want to give a quick nod to our incredible Child Life providers and how amazing they've been. Our Child Life program has been exceptional, and we're very grateful for the work and the effort that they put into preparation and support for the families as well as the kids. I wish that was present when I was a kid. I wish I had these women and men, maybe. I haven't met too many men in the field yet in my life at that time. So this is at one of our events, and we have, I believe, 3 or 4 children impacted by RB, and the rest are siblings. And then there's a couple of posters from a couple of our recent family gatherings in the last few years. That's myself with one of our lovely little guys, Connor. He came in for an event, again, a few years ago. I believe it was 2020, with his family from BC. And he had never met anyone else before with a fun eye or a prosthetic eye or a fake eye, whatever we were going to call it. And he was like floored to see me, hang out with me. We spent time together, our families, and had a hard time leaving, FaceTimed me for the next 2 weeks. And I think there was just, like I said, there's a special spark that you just can't explain when someone gets you and understands the things that you've been through. And then lastly, the picture in the top corner is from our picnic. Also last year, the year before, 2022, I believe. And they're lovely gatherings. We love bringing people together in nature and just giving them the chance to share stories. I think everybody just wants to be heard. I also wanted to share a couple of our frequently asked questions. When it comes to retinoblastoma, these are the things that we often get asked about. Do you drive? Do you play sports? Do you have a career or a job? What were some of the difficulties or accommodations that you received in school? What was the most impactful experience from retinoblastoma on your childhood? Where did you receive care? That's a very common one. How many procedures or surgeries have you had? That's also a common one. How many different eyes have you had? That's a common one. Different specialists that you've seen in your life, interpersonal relationships, like are you married? Did you have trouble finding a partner? What were your decision making around having a family and potentially passing on this genetic disease? Things like that. And then, of course, the practical things about having a prosthetic eye in terms of watering and redness and dryness, blinking, things like that. And then I think something that we've tried to work on more as a community is helping these kids to form their story. So they're what we call their RB story. So we each have a unique story that has happened to us or we've experienced in our journey here. And we build confidence being able to kind of script and work through telling our story. And that's something that we've also worked with siblings on, telling and advocating for their siblings' story, because I have a younger brother and I meet many siblings in these programs. And I know that siblings can be very impacted and very defensive or protective of that sick member of their family. So it's very important from our perspective that this is a whole family approach. And we love working with the kids on scripting and finding their best way to tell their story. Thought I would take the opportunity to show you our 2024 event calendar. We don't have all of our ducks in a row yet, but we're getting there. It's still January. So coming up at the end of February, we will have a virtual gathering for the launch of the year. We will be doing a roundtable open discussion style with one parent presenter. Lindsay will tell us a little bit about her and Olivia's story. And then we will have an open forum and a chat between whomever arrives. And then May, we will be doing an eye loss community meetup. This was in collaboration with 2 other organizations. We did it for the first time last year and we had a great time. So we're going to go at that again as well. It will likely be in the GTA area. Saturday, June 8th will be our annual family picnic. Like last year, we are probably going to be in the GTA still, but we're working on location. But please feel free to mark down the date if you'd like to be with us that weekend. We are going to do another virtual gathering in the fall with the eye loss community, and then a virtual gathering in November with our RB community on genetics. And we're going to be still working out the guest speaker, but we are going to look for a genetic counselor or someone who can discuss more of the details of some of the nuances of our rare disease. All the events are free, and we'd love for people to pre-register for them if they're interested in attending by going to our website, which I will provide at the end, and going under our events tab, and they can pre-register for all of the events. Everything is already up there for as much as we have, and we prefer to know if you're coming if you have the opportunity to pre-register. And that is the end of my presentation. So I obviously want to say a big thank you to the community and for you taking your time to be with us and hear from me this evening. I love sharing my story and telling people about this organization. When I say I have these presentations coming up, as much as, you know, it takes me a few minutes to kind of get in my groove, I'm also feel like I could talk about this all day and night, because it really does fill my soul to connect with other people, share my story. I love when people tell me I'm the first person they've ever talked to that, you know, went through the same thing, and they're in their, you know, maybe 20s, 30s, 40s, 50s before they've even communicated with someone similar. And I wish that they had this opportunity and platform when we were younger, and that they knew that we were all out there and there is this community of support. And I invite everybody to visit our website, as I mentioned, rbsociety.ca. Learn more about, you know, what we're doing on social media by following us on Facebook and Instagram, and check out our upcoming virtual gatherings and in-person events. They will be posted and shared online, as well as be available all the time on our website. So I would love to offer, if there's any questions or anything else that your group, oops, sorry, didn't want to share again. I wanted to stop sharing. Here we go. Anything that might have come up that anyone might have wanted to ask about?
Well, thank you, first of all, Genevieve, for this wonderful presentation and for letting families know about all the great services that the RB Society offers to families. And I was really interested to see, you know, especially the peer support aspect, which is, as I had mentioned, what OPAC is really about, connecting families, and to see the little boy who had never met anyone else with RB before, meeting you and meeting other kids and other families. That's so wonderful that you can have those connections made. So yeah, it's wonderful. I am glad we have our parent liaisons here as well tonight, so they can know when they meet RB families at Sick Kids, that they can share this resource with them. You had mentioned there are some maybe brochures or printed materials that you can provide them with, and can send you later their email to connect you with them, so you can send some to them so they can share them with the families, if that's okay. Hi, Michelle. And Susan, is that
Yeah, we'd
okay?
be happy to receive any of your materials that you'd like to send our way.
Yeah, great. Yeah, we have a couple of infographics and things and pamphlets, and not everybody wants paper materials anymore. So I appreciate you letting me know that, and we can definitely get some to you.
Okay, great. Thank
Yeah.
you. If there's a few, then we can at least post them. A lot of times people take a picture.
Yes.
And that way they've got them. And actually, something I was going to mention to you, Michelle and Sarai, somebody suggested we should get a QR code for OPAC as well. That
we
that would be
we talked about
that would be an easier way for people to just sort of access us.
We found a few of our clinicians want that. They want to put a QR code on the back of their badge, and then they can just say, here's the information, go.
Exactly.
Right. Yes.
Yeah.
And we do provide and have information with the Sick Kids Eye Clinic, but I think you guys understand there are a number of different reasons why a family may or may not be ready to reach out or seek support, or there's 100 things going on, and they, you know, don't think that maybe it's relevant, cultural. There's, you know, so many things.
Yeah, and we have also met from time to time people with familial retinoblastoma.
Yeah.
So I'm not sure that they're necessarily connected with you either, because of course they feel they know it all already, having experienced it all generationally. So I think we're going to try and encourage them to connect with you anyway.
Yeah, I appreciate that. Absolutely.
Mm.
Yeah.
And if you have any like flyers, well, I saw one for the February event, but anything that comes up, just email it to me and I'll post it on our social media and our e-newsletter for families as well.
Okay,
and
great.
send an e-blast to our, you know, our retinoblastoma families as like a group within OPAC as well, like I did for this presentation tonight. So yeah, there's wonderful ways to connect. And of course, if you, Genevieve, meet, you know, families, please refer them to OPAC, because OPAC is here to help all families. you mentioned you were interested in learning more about OPAC as well. What we do, we provide the peer support at the hospital and virtually, which Michelle, Susan, and our other parent liaison Karen provide weekly. We have financial supports like grocery gift cards, helping pay for hospital parking passes, hospital meal vouchers, tickets, peer support, connecting families, event tickets to fun things in Toronto. A bunch of stuff that I'm sure your family.
Yeah, we see ourselves as complementary to what you do, not
Yes.
competitive with what you do.
Absolutely.
So,
Yeah.
and I know that some places don't feel that same way, but honestly, that is the way we operate. People need what they need and how they need and where they need. And we're happy to make those connections and let them cherry pick the things that work best for them from each organization that they like to work with.
100%. Yeah, I totally agree. And those are some of the initiatives that we would love to be able to offer. But again, like we do very limited fundraising. So we're more focused on the peer support. We have similar experiences, shared experience. It's not something we can go out and purchase for them. But we love to be able to say, here's access to parking tickets and a Tim Hortons gift card, because we've talked endlessly about how much we'd love to do that. It just takes a lot more. And there are other organizations as well that we often would refer to. Childhood Cancer Canada and a couple of other ones are great for the same kind of things. So I appreciate knowing that you're also in that category, and families really need that too.
Good.
Yeah, definitely we relate. You know, we're a small organization too. We just have our 4 paid staff and the rest are volunteers, and on a board, of course, of volunteers, and limited funding, limited program, not too many events, but we love to refer, you know, families like to your picnic, your annual picnic, things like that to connect families. So that's
our love. And when we can't get together in person, because we know not everybody comes to Toronto. Many of us do, because that's where retinoblastoma care really is the best. But if you're not coming into Toronto all the time, then we've started doing more things virtually. And we really see a lot of families pop out from more remote places that can't get out and meet us. And so that's been wonderful too. As much as the Zoom situation has been challenging for some, it's also opened us up to meeting a lot more people.
Same here,
for sure.
For sure. Yeah. So great. So any questions, Susan, Michelle? Well, I'm glad we can connect and develop this good partnership between our organizations to help the families, right? And share information and resources and everything. So we'll be happy to do that for sure for your events and programs. And yeah, you do the same, you know, like I said, if you meet some families who want to connect with OPAC, just let them know about us. And so thank you very much, Genevieve, and Jennifer too. I see you for being here tonight. And like I said, this was recorded. It'll be up on our YouTube tomorrow, so I'll post that on our social medias and e-blast so families can watch it. It's a wonderful presentation. Thank you.
Thank you
so much for all this.
Thank you very much.
Right. Have a good night, everyone. Thank you.
Thank you. You too. Bye now.